Hey everyone, welcome back to Static Cardiology here on EMTV. I'll be giving you an ECG rhythm and a scenario. On the bottom of the screen, you'll see a timer for 1 minute and 30 seconds. This time closely resembles the average amount of time you'll want to be spending on each card during an actual National Registry exam. When the time is up, we'll go over the rhythm and I'll give you my treatment. Enjoy the card and good luck.
3, 2, 1.
Well, I hope you didn't find this card too difficult. Let's go ahead and take a look at the rhythm in a little bit closer detail. Now, full disclosure, you're actually looking at an 8-second strip, but I did provide the rate within the scenario. The reason I did this is because I wanted you to be able to actually see the rhythm as it progressed along the EKG. So knowing that my patient's pulse is 52, I'll go ahead and first examine the rhythm for P waves. I'm counting 8 P waves present. You'll notice on this rhythm though that I'm only counting 7 R waves. This means I have a non-conducting P wave present, which would immediately point me toward one of the AV blocks. When examining my R to R intervals, they seem to be growing longer, before a complete drop-off of a QRS complex. You'll also notice that my R to R interval is inconsistent. Because of this progressively lengthening PR interval and a drop-off in QRS, my diagnosis of this rhythm is going to be a second-degree type 1 AV block, also known as a Wenckebach or a Mobitz 1. Now, let's go ahead and take a look at the scenario. You were dispatched to a local restaurant for a 71-year-old male with an unknown medical complaint. Upon arrival, your patient is alert and oriented and reports he has been experiencing episodes of dizziness and lightheadedness that nearly caused him to pass out over the last hour. He denies falling and states that he only wants to be checked out by EMS, as he does not want to miss his anniversary dinner. He appears pale, lung sounds are clear to auscultation, and he denies any shortness of breath or chest pain. He reports a history of high blood pressure and high cholesterol, but denies any history of arrhythmias. Your partner obtains the following vital signs: blood pressure 70/28, pulse 52, respirations 21, SpO2 93% on room air, and a blood sugar of 158. You attach the monitor and see the ECG above.
EMTV.
Now, in order to be successful in static cardiology, not only must you diagnose the rhythm correctly, but you must also make the determination whether or not it is stable or unstable, and then choose the appropriate treatment algorithm. For unstable criteria, I use the acronym CHAD. And this, of course, stands for cardiac insufficiency, hypotension, alteration in mental status, and dyspnea. Based on my patient's presentation, as well as his vital signs, my final diagnosis for static cardiology is going to be an unstable second-degree type 1 AV block. Now, let's go ahead and move on to the treatment. Just like with all my other cards, I'll begin treatment by regurgitating the mantra. Scene safe, BSI, IV O2 monitor. Because this patient is bradycardic, I'll then consider the administration of atropine, 1 mg rapid IV push. However, because I've already determined that my patient is unstable, and unstable gets the cables, my most definitive treatment is going to be the administration of a transcutaneous pacer. As my patient is awake, I'll consider sedation with the appropriate sedative medication, and then I'll attach the pads to the patient's chest and turn on the pacer. I'll select a rate of anywhere between 60 and 100 ppm, and then I'll increase my milliamperage until I achieve electrical capture, and then I'll check a carotid pulse, assuring mechanical capture. For additional blood pressure management, I may consider the administration of a vasopressor, such as a dopamine or norepinephrine infusion. And finally, rapid transport. And that's it! If you enjoyed this card, please make sure to head over to my channel for more. And while you're there, make sure you like and subscribe, and check out my shop on Teespring. Especially my newest shirt, the Survival Loop. This is one of my favorites because obviously I nerd out over this kind of stuff. Thank you again for watching and continuing to support my channel. Until I see you next time, stay safe, keep washing your hands, and have a good rest of your night.